We'll start the meeting. So good morning, everybody. I'm now going to call this Grand Erie Board of Health meeting to order. Kim has sent regrets. Maria is absent on a holiday somewhere above the North Sea at the moment, I think. Rose, I think, is going to join us online, so she may come, although she's not feeling very well. So I'll start with a land acknowledgement. And before I begin, I'd just like to share a brief note of context for our land acknowledgement. We've received preliminary feedback from the Six Nations of the Grand River, and I want to remind everyone that the land acknowledgement is, as we said, a living document. And as such, it may change as we continue to listen, learn, and make thoughtful updates as that feedback evolves. So with that in mind, I'll read our land acknowledgement. Grand Erie Public Health serves the City of Brantford, the County of Brant, Alderman County, and Norfolk County, and is found wholly covered by Treaty Number 3 between the lakes, with the Mississaugas of the Credit First Nation, and partially by the Haldeman Proclamation of 1784, which includes the lands of the Six Nations of the Grand River. We honour the historical homelands of the Neutral and Haudenosaunee peoples. As determined defenders of public health, we commit to continued collaboration with our Indigenous partners and the wise stewardship of the land on which we serve. And there is a note, and I should have read it, Haudenosaunee is pronounced Haudenosaunee, so I will next time get it right. So apologies to that group of people. So, conflicts of interest declarations. Board members are reminded of their obligation to declare any pecuniary interests, as well as any actual or perceived conflicts of interest. Are there any declarations at this time? If not, let me be the first one to hear about them. So moving on to the approval.
I'm going to have to declare a conflict of interest with regarding the BBN OHD rep.
Okay, that is noted. Approval of agenda. Can I have a motion to approve today's agenda? Tom, thank you. Mike, thank you. Are there any discussion points? Anybody wish to add things to it or take things from it? Seeing none, I'll call the question. All in favour? Motion is carried. And the recommendation is that the May 13th, 2026 Board of Health agenda be approved as presented. We have no delegations or standing reports, so we're going to move straight on to item number 7, our programme reports. And we have one, I think, this week. Yes, and it's infectious diseases, infection prevention and control, IPAC Hub and Sexual Health Clinic Services Programme Annual Report. And Philip is going to speak to us. Welcome, Philip.
Yeah. Morning, everyone. Today I'll be speaking about the programs I lead, which include the infectious disease team, infection prevention control, sexual health, and the Brant IPAC Hub. The most commonly reported diseases of public health significance in our jurisdiction include influenza, chlamydia, latent tuberculosis infections, gonorrhea, and syphilis. I do want to highlight that we've achieved a 100% completion rate in our personal service setting inspections, daycare inspections, and food premise inspections in our institutions. I also want to mention that across all of these programs, our team remains proactive in communicating important messaging to our partners, identifying innovative solutions, and leveraging technology to strengthen the work that we do. We're also committed to addressing any gaps in service and improving access to care and support for our communities, with a particular focus on priority populations. If you have any questions at this time, I'll happily answer them. Thank you.
So I'll open the floor to questions from members to Philip.
Thank you, through you, Mr. Chair. Philip, with regarding to the food inspections, what time period do we allow the targeted food inspection premises to get their act in order before we take action? What's the normal time?
So through the chair, we typically inspect food premises on this team for institutions like long-term care retirement homes and daycares. And if we do notice an infraction and inspection, we work with the operator very quickly to make sure that everything is addressed. If it's something that's immediate, it has to be corrected right away. If it's something that is a lower infraction, we do give them a period of time to make sure they come back into compliance. But any immediate health hazards are dealt with right away.
Thank you.
Any other questions? Just add one comment, if I may, Philip. Your table 1 kind of tells a story all on its own. That if you look at the influenza line, the number of COVID-19 outbreaks, they tend to run as one's going down, the other one's going up. It seems that the precautions we took when we had COVID benefits to the spread of influenza. Any reason why that experience should not have carried forward?
So this year in particular, we actually did have a lot more influenza cases. It was this respiratory season was heavy on influenza in December and in January. We did ensure to provide communication to our homes, to our healthcare providers, and making sure that they are focusing on the important things like hand hygiene, masking, ensuring that immunization still remains a priority. Just in this season alone, we did see a significant spike in influenza cases compared to last season. That was dominant this respiratory season.
So the number of 2 in 2021, was that an aberration? Or was that a function of the precautions people took to prevent themselves getting COVID?
The chair, at that time during the pandemic, COVID-19 was the primary disease that we did see during the respiratory season and throughout the pandemic. And at that point, that was the dominant disease that we were seeing. So influenza cases were quite low, we almost had none, just because that's what was circulating in our communities and in the world.
Thank you.
Thank you.
If there are no more questions, I'd like to get a mover and a seconder to receive this report for informational purposes. Thank you, Greg. Thank you, John. All in favour? That's carried. Philip, thank you very much.
Thank you.
So I'm going to move then on to new business and start with item 8.1, financial results. Brad.
Thank you. And through the chair, this report was essentially presented to the Finance and Audit Committee this past Monday as is. It was the first time quarterly results have been presented in this fashion to both the F&A Committee and the Board of Health as a whole. So I'm open to feedback as to the information that is being provided, the level of detail, and what you'd like to see in future quarterly reports. In this report, I provided 7 appendices that separate financial results based on how the programs are funded and how we would report the financial results to those funding organizations. Appendix A is related to the mandatory cost share programs and is funded by the Ministry of Health and the municipal partners and runs on a January to December funding calendar, but for some small one-time funding that we've received for COVID and for Public Health Inspector Practicum. I've highlighted 4 areas in the report where the actual expenses differ from the budget by material amounts, which include salaries, rent, program supplies, and building repairs. Appendices B through G provide financial results for the merger funding, which is 100% Ministry of Health funded, Healthy Babies and Healthy Children, which is 100% funded by the Ministry of Children, Community and Social Services, the Canada Prenatal Nutrition Program, funded 100% by Health Canada, the IPAC Hub, funded by the Ministry of Health, Planet Youth, funded by Health Canada, and the Sheila Basler Center Grant, funded by that organization. With the exception of the last one, the Sheila Basler Center Grant, all these programs run on an April to March fiscal year. Thus, what you were seeing is the 4th quarter. You'll also note that for each of these programs, the Q1 period or the year-to-date period, which is the 5th column on those appendices, is break even. Expenses equaling revenues, which indicates that these projects did not run a deficit. And for all these programs, we fully expended the available funds, resulting in no funding being returned or payable back to the funder. And with that, I'll take any questions.
Thank you. Let me open the floor to questions to Brad. Mike.
You
Through you, Mr. Chair, I just wanted to compliment Brad. He did an excellent job on the finance on. And I do like the format of the quarterly report. That's excellent. It's just like my condo corporation, done the exact same way. We must be using the same program. Anyway, no, that's excellent. Thank you. It's pretty concise. Now, you mentioned the monthly one. Going forward, how often will we get it monthly?
We discussed at FNA quarterly,
Okay.
and the FNA committee meetings align with providing quarterly financial results.
Okay.
So we'll present to the FNA committee, and then in the same month, that report would come to them.
Okay. All right. Fair enough. That's good enough. Okay. That's it. Thank you very much.
Welcome, Rose. I understand you're not feeling very well, so if you don't want to speak, wave at us or something. Any other questions to Mike? Sorry, to Brad? No, I'll just have a comment. I presume that you generate this internally on a monthly basis for your own purposes. So that if ever there was a need to see it outside of that quarterly schedule, we could see it.
Yeah, to the chair, we run these monthly, paying particular focus to the payroll expenses being the largest expense that we incur. So I do keep separate reports that analyze payroll program by program, line by line, to look for those discrepancies. And then these reports are available to managers at any point in time. So we have conversations with the managers and directors of trends they might be seeing or items they see in their financials, things coded in the wrong spot, lines that have the ability to spend or things they need to cut back on. And those conversations happen almost weekly.
Thank you. So no further questions, and I would appreciate if somebody could make a motion to receive this report for informational purposes.
I'll make the
Mike,
motion.
thank you.
Sorry.
John, thank you very much. Any further discussion? If not, then I'll call the question. All in favour? That is carried. Thank you very much, Brad. Moving on to 8.2, the BBNOHT Joint Board Representative. This is where you're going to recuse yourself, Mike? Mike got over.
Yes, I've seen that I'm the current one.
Okay, well, I have no objections to you staying, because I suspect that you will be eventually renominated unless somebody would like to take that position from Mike. Mike, would you be willing to continue in this role?
Yes, I will.
Thank you. I do appreciate that.
Can I make a note as well? Through the chair, Member Bonner indicated that he will be absent at the next meeting on May 19th, which is coming up. So if we would like to have a member attend in his absence, we will just need to appoint an alternate member to participate when he is unable to go, or if no member is able to attend, then we will just have to mark ourselves as absent for that meeting.
Would anybody like to stand in as a deputy to Mike for next month's meeting?
It is, if I may, it is by Zoom, and it takes approximately an hour. We all meet by Zoom.
Yeah, then I will take that one. I'll do it. You just
Thank
let
you.
me know the details, Mike. Thank you. So we do need to confirm Mike in that role, I think.
Yep, so we will go with option A.
Option A, you're option A, Mike.
Confirms.
You were always option A on this one. So we have a motion, which is that report 2026-023 BBNOT board representative be received for informational purposes, and that the Board of Health proceed with option A as outlined in the report.
We
And
can
I guess that's going to be
That's the motion.
Mike, that's the motion. So could I get somebody to make that motion? Thank you, John. Greg, thank you for seconding it. Any further discussion? Seeing none, I'll call the question. All in favour? Once
Thank you.
again, Mike,
for the
thank
vote of
you. I
confidence.
appreciate you taking. I did the role when I was working at the family health team for a while, so I do know some of the characters there. Moving on, 9.1, the Finance and Audit Committee. Mike, would you wish to give a short verbal report as to what happened at our meeting?
The Finance and Audit Committee met on the 11th. We have presentation from Jennifer Chowan at large regarding the audited financial statements. One thing I do want to note is that the Public Sector Accounting Standards Board has a different accounting method than the province. So there's a little bit of a discrepancy there. Jennifer did note that there's a couple of risk factors, one of them being the money owing to municipalities, and also the other one being employee future benefits for the remaining unionized personnel. We had a report from the Q1 2026 financial position, which Brad has just mentioned, and also too that it was recommended and motioned by the committee that Brad meet with the 4 municipality reps regarding the finances, regarding the year-end finances. That will be presented for us at the June board meeting. We also have another Finance and Audit Committee on June 8th. Is there anything I missed, Brad? I think we're good that way. Thank you.
Mike,
I'll take any questions.
sorry if I may, Mike, you may want to mention the conversation about the surplus and the direction the committee gave to.
Yes, I should. I know it's a election year, but I will mention the fact that I'm kind of hoping to avoid that. Anyway, yes, Jennifer Chow did mention that the Grand Erie Public Health had a surplus of roughly 4.11 million at the end of December 2025. Correct me if I'm wrong.
1.4.
1.4, sorry, 1.4. It's still a surplus, but and what can I say?
Well, Brad, you may want to.
Brad can fill us in more on that.
So that pertains to our mandatory cost share programs, a
Right.
surplus of 1.4. The way the funding formula works with the province, none of that is repayable to the Ministry of Health.
Right.
So the option is that it is retainable by Grand Erie Public Health to keep for a future period as a reserve, or could be returned to municipalities. So that's the conversation that the F&A committee was to keep it as a reserve, seeing that we have risks moving forward with wage harmonization and facility related costs post merger. And so we're going to bring that recommendation to the board in June.
Thank you. That's great.
But there was one more step, if I may. Brad, we did ask that you
Yep, I'm going to have that
each of
conversation.
the finance departments of the 4 municipalities, just so they understood what the process was that we were following there.
And that will be presented at the June meeting. Thank you. Thank you, Brad.
Thank you, Mike. Do I need to get a motion to receive Mike's report?
We can't, yeah, for informational purposes.
Yeah.
I'll make the motion then.
Yep. Any further discussion? Seeing none, all those in favour? Thank you again, Mike. Moving on to 9.2, the governance committee. I'll hand it across to Rose if she was able to speak.
I can speak. I might cough through the whole thing, but I'm here.
Rose, before you start, I just want to say congratulations. I'm not sure everybody knows, but Rose got married in between the time of the last meeting and this meeting.
Congratulations.
Congratulations.
Thank you. It was an Italian dream. It was beautiful.
Wow.
I might have brought a souvenir back with me that I wasn't into. Here we are. So the governance committee brings forward for your approval a new policy, the management of property policy. We didn't make too many changes to the policy that I believe was already in existence, but it just goes over how we manage and keep the inventory of our property, the steps that we go through with the acquisition and disposition of property, the parameters to which any leases that we sign, as well as insurance policies related to those those leases, who reviews the contracts, things like that. So any questions from the board can be forwarded to us at this point. That's it. That's all you got for me.
Thank you, Rose. Any questions to Rose on this issue? Seeing none, then could I get a motion to approve the recommendation? Thank you, Greg. Seconded by Mike. Any further discussion? No, I'll call the question. All those in favour? Motion is carried. Moving on to the consent agenda. I'll begin by recognising that item 10.3 and 10.4, Mike, I believe you have a verbal report for. At least that's what my notes tell me.
Just a minute. Yeah, it's in the
Just wanted to give you a chance to speak to it if you.
no, when you go there, John, you'll get an excellent presentation from Dr. Ben Dignan regarding the State of the Union. We're making progress with getting people family doctors. That's the number one thing right now. Other than that, everything's in the report.
Good, thank you. Does any member wish to remove an item from the consent agenda for discussion and debate? Seeing none, then could I get a motion to receive the consent agenda for information? Tom, thank you. Seconded by John. Thank you. Any further discussion? Seeing none. Oh, you want a discussion, or are you going to vote?
Yeah, I'll be voting against the entire consent agenda because there was no reports attached to any of this. You want me to vote for a report, but there's no way to look at the report. So I can't vote in favor of.
There is, but Nicole, you might want to explain.
It was noted in the email. It's all uploaded to share file. We can start actually attaching everything to the agenda if the board wishes to proceed that way. The only item we wouldn't be able to attach is the consent agenda. I mean, the
I couldn't get into
confidential
share
minutes.
file, so I had to go into the website, and on the website, there's no way to connect to any of the information that should be there.
Okay, but typically you can get in through share file. So if you've got a share file problem, I guess Nicole,
Yep,
you'll
I'll
be able to
connect with
solve
you on
that.
that.
So with the exception of Greg, can I ask all those in favour? Motion is carried. Thank you. Notices of motion. Does any member have a notice of motion for a future meeting? Seeing none. We do have some upcoming agenda items, but as a reminder, we will be holding a special meeting on Friday, June the 12th. This will be a full day strategic planning workshop. And just for my benefit, does that bring us to a conclusion in terms of input?
Yes.
This will be the
So that's the
second or third
amalgamation
time?
of all of the surveys from both staff and our community partners for us to finalize priorities.
The board will then meet in regular session on Wednesday, June the 17th. And the following agenda items will be presented. Program report on substance use and mental health. A drug strategy report. Special topic report, which will be Planet Youth Project update, which I'll be interested to hear about. I think that's, for those that were on Brant County Health Unit, that's something we don't know very much about. There will be a finance committee report with a recommendation for approval of the December 31st, 2025 audited financial statements. There'll be a governance committee report, which will include a Board of Health self-evaluation report and discussion, and a 2025 audit review. Last chance. Are there any other items you'd like to add to that list of upcoming agenda items? It's pretty comprehensive, so seeing that, then no. Okay, then we're going to move into closed session. Can I get a motion to enter closed session to discuss the items 13.1 pursuant to section 239 brackets 2 brackets B of the Municipal Act 2001 as amended, as the subject matter pertains to personal matters about an identifiable individual, including municipal or local board employees, and items 13.2 and 13.3 pursuant to section 239 brackets 2 brackets H of the Municipal Act 2001 as amended, as the matter pertains to information explicitly supplied in confidence to the municipality or local board by Canada, province or territory, or a Crown agency of any of them. Is there any discussion of the motion? Who would like to move that motion? John, thank you. Seconded by Mike. Any discussion? Seeing none, I'll call the motion. All those in favour? The Board of Health will now move into closed session. So back in open session, we have three motions to report from closed session. Motion one, can I have a motion to receive the verbal report regarding item 13.1 for informational purposes? Thank you, Mike. Thank you, Tom. Any further discussion? Seeing none, I'll call the motion, call the vote. All in favour? Motion is carried. Motion two, can I have a motion for staff to proceed as directed in closed session regarding item 13.2? Thank you, Greg. Thank you, John. Any further discussion on that motion? Seeing none, all in favour? Motion is carried. Finally, motion three, can I have a motion to receive the verbal report regarding item 13.3 for informational purposes? Mike, thank you. Greg, thank you. Any further discussion? Seeing none, all in favour? That motion is carried. Well, unless anybody has any pressing business that would benefit the Board of Health, I'm going to draw this meeting to a close. I look for somebody to make a motion to adjourn. Supported by Greg. All in favour? This meeting is concluded. Thank you very much.
Thank you.